couple of things. One is just to answer questions and then talk with you all about what to expect over the next day or week or so and see where we go. Let's start with the IV fluids, Nancy. I look at it really as an intervention we started with a clear purpose, which was to see if it would make her more awake. And I think it did for a little while. I'm not sure it's doing it now. The other thing that Mrs. Kerr was always very clear to me was that when it was time for her to die, that we don't prolong it. And certainly intravenous fluids will prolong it, but they won't make her quality better. I think that it's going to cause more discomfort than comfort now. And it's one less bag to have at the bedside.
If it worked, fine. If it didn't work,
Right.
stop.
We said that from day one.
Right.
Everything.
Right. It's still hard to do sometimes.
Sometimes I don't know if we should be working to get her more alert or just letting her, I mean, you can, get her to open her eyes, but I don't know if that's helping her or helping her mind, or we should.
Everybody's different. Just when she wakes up and is more alert with you, if she seems to enjoy that, do it. She may not respond, but I'm sure she hears you. So, conversations that you wouldn't want to have in front of her, don't. Okay? Always believe that she's hearing you. Normal things not to worry about which happen. Okay? Very normal things. The amount of urine she makes will start to drop off. Her breathing pattern will change. And first, what's happening now is her breathing may start to get a little faster and shallower. Okay? And then it may start to get irregular. And then what sounds like gasps. Okay? That's not air hunger. Okay? And I want to be very, very clear. Okay? It's not that she's suffocating. That's just normal. What morphine does, and drugs like morphine, is it prevents the body from sensing that your chest is moving really quickly, from sensing that there's not enough oxygen. So it's really important to realize that even though her breathing may get faster, it may get slower, or she might have long pauses where for you or I holding our breath would be very uncomfortable, she's not going to perceive that as being uncomfortable.
She won't be scared.
She won't be scared, okay. She won't know what's happening, and she won't be short of breath. The other sign, while I'm here, which we need to talk about, is a gurgling sound that you might hear in the last day or so before death. Okay. What happens is when you start to lose the ability to swallow or to clear secretions in your mouth, there's a very thin layer of fluid that builds up over the vocal cords and the trachea or the breathing pipe. Okay? And as air moves up and through that, it sounds all the world like somebody could be suffocating or choking. It can be very distressing to listen to. Okay? It's really important to realize that all that is air moving through a thin layer of fluid. Okay? It's not as if she's suffocating. It's not as if she's choking. It's just a really lousy, terrible noise which is made by something very simple. A couple hard questions. Is she ready?
Yes.
Yeah.
Okay. And you have, everybody who said goodbye has had a chance to say goodbye. Okay. Last practical thing is what happens when she dies. Don't call an ambulance. Don't call 911. Don't panic. Okay. We've talked a little bit about, what's going to happen. She'll probably take a last breath, a couple shallow breaths, and that will be it. Okay? And after that, there's no rush. All you need to do is call the hospice. Okay? Call the hospice. Just let them know that she died. They'll send a nurse.
Just time. Yeah, that's it.
It's just time. There's no right way to do this. Okay? There's absolutely no right way. It's really who you are and how you want to do.
I mean, it's going to do tomorrow. We just do it. Whatever.
That's from experience as a family.
Yeah.
The most important part of my job is listening. Mrs. Kerr and I spent a lot of time talking about very hard issues so that when this time came, I knew who she was. And we could go through this in the way that she and her family would want to do it.
But how many doctors can take that time to get to know who the dying person is?
There is no question it takes time. but it doesn't take as much time as many of my colleagues think it does.
I think she has an easier time talking to you, a stranger, where she didn't want to upset us or talk to us about those types of things, and she's very open and willing to talk to you about it.
Do I get close to my patients? Yes. I mean, it's hard not to. If you start opening up the doors to talking about what is one of the most meaningful experiences of life, which is dying, it's hard not to get close to people.
What gives it that meaning?
The mystery. I think that gives it a tremendous amount of meaning. We've shut this out for most of the last 30, 40 years in medicine, and this gives it meaning. Families who are together to talk about what's important to them. It's one of the few times in life where people sit back and think about what their life has meant to them, what they would like to accomplish, what they would like to leave as their memories. And those are questions that I ask.
Later that night, after Dr. Morrison's visit with the family, Joyce Kerr died.
I don't remember the exact time. It was in the early evening where Nancy became concerned because the breathing changed. And she said to the peers that something's going to happen, you all better, gather around. So we sat there, and I would say it was probably maybe 8 or 9 o'clock at that point. And you could see Joyce was going downhill. And then I would say around, in fact, it was exactly 10 minutes after 10, her breathing was quite labored, and all of a sudden she just put her hands across her chest and stopped breathing. And Nancy got out her stethoscope and listened and knew that was it.
This body we commit to the ground, earth to earth, ashes to ashes, and dust to dust. Blessed are the dead who die in the Lord.
We were all right there, and very fortunate, very fortunate. Really wouldn't have had it any other way if possible, There's nothing I can think of could have changed, or should have been changed, I should say.